things that she does not put on her bio, and I'm going to reprimand her for that. Mary was also Citizen of the Year last year, and we were proud to recognize her. But I learned a lot about her during that time. She has a large family and things. But I want to read a segment of a letter that was sent in with her nomination. And this is what the individual said. Mary grew up in a huge Italian family of 10 plus children in Chicago, the root of her family values and work ethic. She labored in the family deli, nights, weekends, and summers, and still works there when she goes home on vacation. She is one of the most unassuming individuals I know. You can be volunteering shoulder to shoulder with her, and you would have no idea you are with the chief of the Mesa Fire and Medical. She has no interest in impressing. She is simply there to get the job done. I am very proud to present as our program today, Mary Camelli, Chief of the Mesa Fire Department.
Thank you, Joe. That was very kind. And it's good to see all of you. Many of you I know. It's very nice to see you here. And Chaz, I think you kept the Sergeant at Arms very humorous. That's very good. Kept it going. 14 years in the Rotary doesn't compare to probably some of you in this group. I know, Dill, you have like 40 years. Is that right? In Rotary?
About 48.
Oh, sorry. I miscalculated that one.
That's all right. When you pass 35, it doesn't matter.
But many of you, but thank you for your service. It sounds like a very active club and one that many should be proud of. I've been involved of Mesa Sunrise, as you heard, and we have fun in our group as well. I tell you what, I really enjoy having the chance to talk to you about Mesa Fire Department. This is something I'm very proud of. I'm very proud of our members, and we couldn't do what we do without our support. We have great support from council. I see Jen Duff here and Dennis Kavanaugh, who is also very supportive of us through the years. What we accomplish, it comes with a lot of support from both our council and our city management, and we've done great things because of that, and I appreciate it. Just for those that don't know, I'll just give you a brief overview of our department. We have 20 fire stations, soon to have 21 fire stations. It's going to go up in Eastmark. They've already broken ground on that, so that for those that are living in Eastmark, that station should be done September, October of next year. We're very excited about that one. That's been a long time coming, and that will give us station number 21. We have just under 500 sworn firefighters, and then another 150 members that support our operation with technical services, our dispatchers, our mechanics, you know, our trainers, everybody behind the scenes that really makes us accomplish our goals. Last year, Mesa Fire ran on about 70,000 calls. So we're a very busy fire department. 80% of those calls are medical. But you know, then folks ask, why do we still do a lot of training on fire? That's so important for us to continue our training in the fire side, because even though that's 20% of our business, we never know where or when they're going to occur. And those are the incidents that firefighters get killed across the country. So it's so important we know our business well and we train well, and that's what we do on a regular basis, and we continue to do that. Something about our department that is important to me is our mission statement. And I always say this when I speak, is ask anybody on our department what our mission statement is, and they should be able to tell you. And I'm going to do a test because I see that I have one of our deputy chiefs in the room, Chief Brian Yaks. And Chief Yaks, will you tell the Rotary Group what our mission statement is? We're going to put him to the test right here and right now. Unmute. Did Brian leave?
Maybe he doesn't want to get unmuted.
Uh-oh, he's looking it up right now.
About the four-way test, most of them wouldn't mute.
I did this in another group when we just got the new mission statement, and there was one of our firefighters sitting in a crowd, and I said, Jeff, tell him what our mission statement is. His mouth opened so wide, I went, oh my gosh, I put this poor guy on the spot with about 200 people in the room. I answered the question for him, but I said he will never forget it from this day forward. So Brian, are you there? You must not be listening. But anyway, our mission statement is to serve with care, compassion, accountability, respect, and excellence. And every fire department that you meet should be able to recite that to you. I feel like if they don't know what our mission is, it's hard to follow, you know, and they do this every day, and that's one of the things that's very, very important. Of our calls, something that we're seeing a trend in is our behavioral calls are definitely on the rise. And we're managing that. Right now we have a program in place. We've partnered with a behavioral health group, CPR. We have 2 crisis counselors 7 days a week that when we go on a call that has behavioral in nature, as soon as we assess that there's no medical with this call, we send the crisis team, and then they do the assessment on this patient. Normally, when we have any kind of behavioral calls, let me just give an example, like suicide threat or suicide attempt where there's no medical component attached to it, we take them to the ER because you cannot leave someone by themselves. This crisis team assesses the patient, takes them right to a behavioral facility where they get the care that they need immediately and just bypass an ER. That's really unprecedented. For years, that's what we've been doing. We have to take them to ER. With this plan in place that we've been doing now, we did it with a grant 3 years ago, and now we still have the partnership for the last year of doing that with our behavioral health, and we'll continue to do that. And we're looking at other ways to handle behavioral health. We're working with our police department right now. Mr. Brady tasked us with another program that's going to help reduce the amount of times PD has to respond on these behavioral calls. So Chief Cost and I are working on a plan right now to come up with some kind of staffing model that addresses just that. So that's something that's really outside the box that we've been working on. We have a little bit about our organization. We have 1,000 people who test for our department. We open up the test every 2 years, and we have about at least 1,000 people who apply. Every year we hire, it depends on the retirements, between 25 and 50 a year. So it's an extremely competitive process, and we're trying to make it so as many people that want to be in this world can at least have the opportunity to apply. Of course, we can't hire everybody and we can't interview everybody, but we do our very best to keep the process so everybody has the opportunity to put in for this type of job. While we're being innovative in that and trying to work on ways, we're working with ASU. We've had students do a capstone project on what can we do to continue to make our organization diverse, and what we need to do to enhance that and to open it up to make sure everybody has the same opportunity. We're working with ASU with that as we speak on ways when these young students come forward with their ideas too. And we think having these partnerships with these schools like this and these colleges and these interns is very helpful for an organization to stay innovative and creative and continue to look at ways to do things better. Our department, you're going to see when you drive around the city, you'll see, of course, ladders and engines, and also you will be seeing MRs, they're medical response vehicles. These are like Ford 550 trucks. We have a big back of the cab. It's not a fire truck, but it's like a small version of a fire truck. These are our medical response vehicles, because I mentioned that 80% of our calls are medical. So what we do is at a few of our stations today, we have an MR attached with a fire engine. So if there's medical calls there, the MR unit will respond on the call first. And if there are on other calls, then the engine will take it. We need to have a fire engine strategically placed across the city. So one fire engine or fire ladder at every one of the 20 stations. So if there's a fire in your area, you don't have to wait 15, 20 minutes to get a engine there to start putting the fire out. Fire doubles fire accelerates very quickly. It's like it doubles in size every minute, basically, and depending on the outside factors, wind and stuff like that. So we want to make sure our response times stay down in terms of responding to fires. So some of these busy stations we've attached next to an engine and MR unit. So you'll see these vehicles running around. They're all firefighters. So if we have a big fire, they still go and help. But their main goal is to get out on those medical calls and save the engines and the ladders for the fires. So those are called MRs. Something else that we're doing is we have a lot of calls in our community for falls. And we have a social service team now that's been going out into areas. We look at the data. We've been really utilizing data a lot to see where we need to address things. We've been using data now to see where we have an excessive amount of fall calls. We will go in there and do some education. We send our team into homes. We call them. If we've gone on a call with someone that has fallen multiple times or more than once, we will reach out. Our team will reach out to them and offer to come in the home and look at the home and see if there's things that they can do to help mitigate and reduce the number of times they fall. Number one, it's best for the patient, because some folks that live alone, number one, it's best for them, but also reduces the chance of them falling again. We'll put pull bars in the home, talk about rugs that weren't a hazard at one age, but they can be a hazard when you turn 90. And so they look at that and see what the trip hazards were. And so we are doing this as a team. We've been doing this for about a year. And the number of calls, we've done data, taken the number of times we went in residence for the first 6 months, after we went into their home, did an assessment, helped them with social services, whatever else they needed, the amount of calls that were reduced the next 6 months in these same addresses has been tremendous. So we're trying to do what we can outside of the box to help reduce 911 calls and basically to keep the community safe. All ages, generally it's the elderly that we find on these type of calls, but this is really an important piece of our business, because this is like when we went out and did a lot of fire prevention, we still go in the schools and talk about that and talk about being safe. But this is another way that we're out in the community now, trying to keep communities and members in the community safe, preventing them from falling, since we can see patterns, and we're trying to get out there and really share things and prevent them. Another thing that's important to us today is cancer awareness. As you know, firefighters across the country are dying of cancer. That's probably the #1 thing. Well, it's heart and it's heart attacks. Cancer's right up there. But we've had a lot of support in this area too. We're doing everything we can to reduce the risk. We're having what's called, we have new fire trucks come in, they're called clean cabs. That's where we used to carry our air bottle and everything right behind the seat. So as soon as you get in the truck on a fire call, you put on your gear, you put on your tank, and you go. Well, a lot of carcinogens that are still emitting fumes and things like that from these things that we bring into a fire. Our new trucks have the tanks outside the truck and they're in compartments. So as soon as we get on the scene, you open a compartment. So if you see a firefighter putting on their tank once they get on the scene, it's because those are one of the newer trucks that we're taking these this equipment that always has a lot of, those are the ones that go in the fire. You can only clean them up so much. They still will emit some, fumes and all that. So we keep those outside the truck now in a compartment. So when you see firefighters jumping out the truck and donning their SCBAs or their tanks, that's why they're doing that. We're also putting in, we've got a grant, we got a $500,000 grant from FEMA this year that we're gonna put ventilating exhaust systems. It's a ventilation system for exhaust in our bays. When the trucks, start and stop so many times a day, numerous times a day, those fumes in the bay can also be cancerous. So we have a grant there. We're gonna put an exhaust system in all these. We're looking at many, many things that we can do to reduce the risks of cancer, making sure our firefighters are continuously washing, making sure. Years ago, when we had soot all over our body and stuff came back from a fire, there was no urgency to clean it all off. As cancer started spreading and we saw the errors of our ways there, years later, we learned that, that's not good to keep that on your skin for hours and hours. And so they go back and they make sure they shower after a fire so they can get all those carcinogens off of their body as soon as they get back to the station. So these are things we want to make sure our members are really safe, and we continue to do that. Today, we're faced with COVID like the rest of the world. Our members go into homes and they've been in contact with many, many patients who've been positive. And, they have concerns, they have families they go home to too. So we make sure one of the priorities is that we have enough PPE for them, personal protective equipment. We have N95 masks. We do daily burn rates. We check how much we have every day, so we know how many days in advance we have these supplies for our members when they go on these calls. Another thing you'll see is we have what's called a P100. It looks like a Darth Vader kind of mask. That's one that can be reused, for 3 months. We just change the cartridges. So if you see firefighters with that on a call, it's because and we give them the choice, the P100 or the N95, as long as they're wearing something. So you'll see them and that's why they're wearing it. These are masks that you don't have, they're not disposable. Just change the cartridge after 3 months and can be used several times. So some of them are very comfortable wearing that, and it's just another safe way. And another thing we modified during this COVID time period is normally we go into every home as soon as we get the call to a 911 call, we enter the house. What dispatch is doing today during these COVID time periods is we're asking if you're able to come outside, meet us outside, less exposure for your family with us coming inside, but also less exposure for our crews. So we send them outside. We have a chair that we keep on the truck. We bring them out there, sit them right there in front. We'll take the vital signs, assess them right outside the house. Nursing homes, we have them pull the patient out towards the front or some area when they can. If they can't, or if someone can't walk, or if someone's too sick, we absolutely go where they are. But those that can walk, we dispatch asks if you can meet them out front, that would be the best, just to reduce any spread in any way we can. We continue to do all of that, and we will. But so many things that we're doing in terms of COVID related. The crews wear their masks in stores. They have to wear it when they're in public, on every call. Even when they're on the truck together, they need to be wearing their masks. So we're doing everything we can for their protection and for your protection too. So we're not the ones that are spreading the, any germs as well. We track this all very, very closely and monitor everything we're doing. But in a nutshell, that's a little bit about what's going on with with our fire department. Do you have any questions for me?
Mary, I'd like to start the questions. And given the last 6 months, we've dealt with a different situation. And I know all of us are anxious to get back to what the new normal might look like. What have you in the fire department learned through this process, and what changes do you anticipate will remain or you see implemented in the future?
Great question, Joe. Thank you. We've learned a lot. We have a lot of meetings. This virtual world has really opened our eyes to how much of these meetings we can do this way instead of driving to different places. I mean, face-to-face is always nice, but I think that virtual meetings for things we have to say, now that we've been doing it for so long, everyone's getting much more comfortable with it. Number one, our meetings in that regard. Number two, our equipment. We track every bit of equipment that we have, and we've always tracked it, but in terms of COVID, when we had to know exactly to the number how many masks we had in the very beginning of COVID, we were very fortunate because we had 9,000 N95 masks that were stored from 9 years ago based on something occurring. And so we were very fortunate that we had all these masks available to us. If we didn't have that, we would have been in a world of hurt of trying to get it. Another thing we learned is, we called FEMA like everybody else to make sure we had the right supplies for, the gowns and the shields and everything that we need so they're protected when you go on a COVID patient. We learned that when FEMA came out, everybody, all the departments that were there to collect supplies got very, very minimal. Like we got like 8 masks, and we burn about 200 a day. We were burning through about, at that time, 200 masks a day. We got 8 masks, one department got 1 shield. And what we learned was when FEMA has a disaster, it's not the whole United States that's faced with it. Usually it's a hurricane or it's a tornado in certain areas. So we learned this too, is that, it's important that FEMA can't do it for everybody at the same time in our country. So it was a good learning tool for us too. And we talked to the U.S. administrator, and it was just a learning experience for all of us in terms of COVID striking everyone. We got our supplies. Everyone ended up getting the supplies they needed, but it was a work in progress when we first started it. So tracking the supplies is a good thing. And actually just making sure we are hyper vigilant today about deconning everything, right? Everything, we are deconning everything, keeping things safe. They've always worn gloves on calls, they've always done that. But I think it's probably a very good habit to get into, is to continue to decon areas, because every year we have flu season, all these things, these little things that we're doing can absolutely prevent the spread. And then for them to be very conscientious, they're very cautious about, what they go home with and all that, because they don't want to bring things to their family. Probably good things for us to pay attention to all the time, because we go on sick people every day. Our crews are going on people that are ill, and things you can actually pass on. You never know if you're the one that passes it on. So it makes us hyper vigilant about that too.
So
Hey, Mary, this is Steve Adams. Hey, I'm interested in the living conditions and with the firefighters and exchanging beds and bedrooms and being in a community and all that kind of stuff. And how are you guys faring and getting infected and stuff like that?
Yeah, great question. You have reason to be worried about that, Steve, right? Your son's right with us, so I get you. No, good to see you. You know what? So the firefighters, we share beds, but they bring their own sheets and their own blankets, so it's their own sleeping material that they're sleeping on. But this is one of the reasons we've gotten all of our stations deconned at one point in all of this, and we will continue to do that. But the main thing is the deconning of the station every day, making sure things are clean, the phones, everything. They're supposed to do that as a daily routine now to make sure that we prevent the spread. In our department today, we've only had, and I'm going to knock on wood because I don't want to jinx anybody, 20 positive, 20 of our members ended up contracting COVID. Only one was hospitalized. He's doing fine now, but out of our 650 employees, we had 20 that were positive. So I think the number is very good. And the most of them that did get COVID were very mild symptoms, except the one. And so I think in that regard, we're doing things, we're being pretty safe and conscientious about everything. And we'll continue to do that as we move along. But basically it's keeping the station area clean, even the truck, everything on the truck, the headsets that they share, all of that stuff has to be deconned every day in that shift change, so we're not spreading anything. That's what each of them are asked to be doing.
Mary, I have a couple questions for you.
Sure.
One, what's the value of your apparatus fleet? And maybe that takes a few minutes to think through. But another question, if you were a firefighter and not the chief in the department, which would be your choice? An engine or a ladder truck? Where would you want to be?
Yeah, all right, fair questions. First, an engine costs us about $1 million when you put all the equipment on and everything. So that's $1 million purchase. The ladder's a little more, about a $1.3 million purchase. All the equipment, any kind of call we respond on, we have something to get through it. You know, we have saws and, you know, everything we need to on a call is there. And as a firefighter, actually, when I was on the truck, I was on an engine. I love the engines. You get to go on all the call, and not that ladders can't go on all the calls. I never really spent too much time on a ladder, but I think an engine company, you get to go right in the firefight and just start doing your work, you know, and run the medical call. So I love that part of it. I love being a captain on an engine too for many years. So I'd have to go with engine.
Good choice.
Fair question.
Overall, so if you looked at your entire department, approximately what's the cost of apparatus that you have out there right now? The value of it.
Oh, of all of the apparatus?
Yes.
Oh, wow. Well, we have 25 engines and ladders. So there's 25 plus the ladders are a little more, probably 26 million. We have some MRs out there, some foam trucks. That would be a guess. It's over 30 million probably. We have foam trucks at the airport. That's our ARF team, aircraft firefighter rescue team. So we have foam trucks, which are, I don't know if you've seen the trucks on the airport. The wheels are, you know, 8 feet high. The wheels are ginormous on these foam trucks that go out there for when planes catch fire on the runways. So yeah, probably 30, 35, based on all of the apparatus that we have out there.
Hey, Chief, it's Brian. I did some quick math and you're right at about $45 million.
No, I was a little under about 10 million, but thanks, Brian. Brian, what's our mission statement while you're on?
Well, I'm sorry. I got to apologize to you about that. I was on a phone taking care of an IT issue and I couldn't get out the phone fast enough, but it's, we'll serve with care, compassion, accountability, respect, and excellence.
I thought maybe you were looking it up, Brian, but good job. I'm glad you were on a phone call and didn't hear the question.
Sorry, I tried to get out the phone call to answer it, but I couldn't get off fast enough.
But you did know it before, correct?
Yes.
I want them to know that you knew it ahead of time. Thank you. Good job. So there's your answer, Ben, 45 million.
Mary,
That's phenomenal.
Mary,
Thank
I
you.
have another question for you.
Sure.
Many years ago, a number of years ago, I served as the dean over the EMT and Fire Science program at Mesa Community College. And one of the things that I learned during that time was there was a real push. In fact, we met with the police chief at that point, a real push for diversity in the department and particularly with women. And one of the things that we did at the college to support that was to do some physical education classes, because the situation was that it was.
You're on. You went on
You're
mute.
muted. Unmute, Joe. You just
Oh.
muted.
Okay, so it was usually upper body strength that was the challenge with women in being able to get into the fire department. So we did some training in that area. What is the situation today in recruiting of women and other minorities, and what is the percentage you see that come on the fire department?
Great, thank you. That's exactly why we got with ASU, and we're looking at our process to see what we can do to enhance that. Right now, women in our department is less than 5%. Across the country, women are less than 5%. And it's just, we can't get them in the door. We've started a program called Aspire. It's a partnership with the Girl Scouts where we bring high school girls in on spring break for 3 days. And it's a police fire academy where we just put them through 1 day of fire activity. They wear the gear, get a feel for it. 1 day of police activity. So it's called Aspire Academy to introduce these young girls to a profession in public safety. because so many don't even know it's an option. I didn't know it was an option, you know, when I was younger. So we want to make sure young girls even know this is an option to put in for it. And so we do our very best to recruit. We're going to the junior high, the junior colleges and things like that to really get out there and introduce this career to so many, and minorities as well. We need to increase the number of minorities. We're doing much better just by opening the door and letting them know, you know, reaching out to different organizations, different high schools, to let them know these are options for them. Really, to get on the job, you need to have EMT and a high school diploma to get in the door, and then pass the process, which is a written exam. It's a common aptitude test that they all take. And then from there, they do 2 interviews. And then we put everybody through an intern orientation, which means we put them on the grinder out of training and have them do some skills and things like that, and just kind of let them kind of get a flavor of what the job is. And we watch them and observe them in this too. Not that everybody has to know how to do everything at that point, but we look at things like their attitude and their drive and their teamwork and all these kind of things while they're out there, to see just how they would fit into this kind of job. Because if you don't like to be around people, this probably isn't a job for you, because you're living with these folks for 24 hours a day. So it's your second family. So anyway, we're reaching out to really see what else we need to do. And that's why we asked them to do a capstone on this just this last year. And we've asked them to go on with the process to see if there's anything in our process that's limiting minority groups from you know, being successful at this, because we want everybody to have an opportunity.
So Mary Lee, following up with that, what drove you to want to be a firefighter? How did you get into it? And for those who don't know, she comes from a large family, but she also has a significant family. What is it, 5 daughters? Am I correct?
Yes, I have 5 daughters. Good memory, Joe. I have 5 daughters, and I'm number 6 of 13 kids. So living with a group of folks was just normal for me, since I grew up in a household with so many brothers and sisters. I have 6 brothers and 6 sisters. So anyway, I had a brother that was on the job. I actually moved out to Arizona to teach school. I have a teaching degree, and I moved out here to teach school, and he was on the job. And I came out after the school year started, and he was telling me about this job. I've always liked sports. I've liked being active my whole life in high school and college. And when he talked about the job, that's the first I ever even heard that this was an option. I went to see his station a couple times, and I thought, you know what? I think I would like this. To me, being out there in the street and, you know, having to be physical, for me, that was a great fit. And so I took the test in 1982, got hired in 83, and never looked back. But that's why I want to get out there for women to know that this is an option for them. But that's how I actually got into it. I learned it from one of my brothers. And
Mary, were you not one of the very first women hired at Mesa Fire Department?
Yes, Georgianne White and I were hired in 1983 together. Yep. And it was new to the community. It was new to the membership, but very new to the community.
And I bet you found some challenges with emerging into an all-male environment that the Mesa had at the previous.
Sure, it was interesting. Every role I was in, I remember driving when I was an engineer, and I'd get off the truck and people were like, women can't drive that truck. They were surprised to see a woman get off the truck driving. And now we have like 3 women that are engineers and driving the truck. So yeah, it was a learning environment for everybody, you know, having women on the job in every call. And usually they thought you were the cook or the secretary on the call. When we get on the house, go in the house, they say, are you the cook or the secretary? And I said, no, sir, I'm neither. I happen to be here to take care of you. But yeah, so we worked through it.
And another question, I think I know this answer, but do all of your firefighters have to be EMT also?
Yeah, they're either EMTs or paramedics. Every single fire truck in the city has 2 EMTs and 2 paramedics. So when someone responds to your home or to your family, you're getting the highest level of care possible. There's 2 medics and 2 EMTs on every truck. We have heart monitors on every truck, ventilators. So they do advanced life support.
Do I
Hi,
have
Mary.
Hi, Randy.
Yo, hey, did the city of Mesa loan officers or equipment out across the country with all the forest fires that have been happening?
Yeah, you know, we have a wildland team. And when they ask for help, we send them. And we didn't send our team to California, northern Arizona. So we have sent our team out there to help. Yes, so we're in a rotation. Like when they need help, they call us. And so we sent our team out several times this past year. Yep, they were in California. And every time we do, I want, pray for their safety for sure. Those are scary times. But yeah, we have a team we send out each time we get requested.
Thanks.
Mhm.
Hey, Mary.
Yes.
So I had the opportunity to ride along, and also we participated in the academy. And one of the things that really, Citizens Academy, one of the things that really struck me as interesting, and I wanted to get your take on this, is the use of technology, of how are you guys using technology to be better at what you do, drones to go out and view the situation. What are the things that you are doing right now, and what are the things that you think will be coming along that will help you become better and more efficient at what you do?
Thank you, Vaughn. That's a great question. The technology we're using today, in fact, all the decisions we're making today are based on technology. We do have drones out there. We use them on incidents where you need an overview of what's going on. It gives you the bigger picture. So when command is running the incident, they can kind of see all the different exposures that they have from the fire or whatever it is, a flood, whatever the incident is. So drones. We've also used data to place our units in where they are today. We did a whole redeployment model last year by moving engines and ladders based on data and the number of calls and where they are. So we moved several units from where they were to different locations based on the data. And we will continue to do that. Brian's working on a new program with PS Tracks. It's tracking every piece of equipment, where it is, and when it needs to be serviced, when it's out of service, every piece of equipment that we have. It's starting out with the bigger and more expensive equipment, but this is a program Brian's just starting right now. We're getting a new vendor for CAD right now for dispatch to make sure we get our units out on the street quickly and the right unit to the right call. We're working on that right now. So we're using technology for numerous things. And Brian is actually our technology chief. He's over technology. Chief Yox, did I miss anything that's new? Oh, our pre-plans.
No, you hit most of it, but basically we're putting vehicle wireless routers on the vehicles, enabling us to be seamlessly connected to the Mesa Regional Dispatch Center. We did some tests and found out that coverage across the valley fluctuates back and forth between Verizon and AT&T. So by putting these in-vehicle routers on the trucks, they're monitoring which has got the best signal, enabling the trucks to get the quickest information on the computers so the guys know exactly what they're going on and the dispatchers can feed them that information. But based on that, we've also been able to connect that to our maintenance facility where they're able to find out when vehicles need to have maintenance on them. We're using those as Wi-Fi hotspots. We're being able to use that also to download the telemetry from the heart monitors to the hospitals immediately. The iPads are all connected through those. Like Chief Camelli said, we're in the process of our new CAD system. We're also looking at a new record management system and connecting drones to all the different command vehicles throughout the valley. A great example of that was the Tempe derailment, where we had our drones on the scene. That was a pretty difficult situation for the guys to command because of the intelligence coming back to the command staff was kind of sporadic and they weren't getting really good stuff. We had our drones there, but that was only going in as a couple of our command vehicles. So now we're working on a valley-wide project to get the drone footage from Scottsdale, Mesa, some of the West Side valleys all fed into, no matter what command vehicles on the scene from what fire department will be able to get all that information. So
That's great.
there's a ton of stuff going on in technology. I got a great staff here that helps me along, but man, there's a ton of it. I could go on for an hour telling you all about it.
They'll have you out just for that, Brian.
Yeah. Mary, our time has kind of come to an end. And as you know, as a Rotarian, we
Yep.
to adhere
Yep.
to that and respect that.
Yep.
I truly appreciate your spending time with us today. I know you have a busy life, and I hope everybody else learned as much about our fire department as I did today. And so again, thank you. With that, I'll turn it back to our president.
Thank you for having me.
Thanks very much, Joe. Mary, you have an incredibly qualified department. I see and know a lot about what I've heard today in the meeting, and you should be very proud. And thanks for your leadership, and thanks for being a Rotarian as well.
Yeah, thank you. Thanks for having me. I am very proud of my organization. I appreciate it. Thanks.
Just a quick review. We don't let this be forgotten. Cultivate membership, support our community and youth services. And let's not forget, this is our 100-year anniversary. So let's have fun. And we are. And let's talk about what's next. So next week, we're going to learn about General Andrew McDonald's interpretation of Veterans Day. And it'll be a fun program and a meaningful program. Following that, on the 18th, we have City of Mesa manager Chris Brady. He's going to talk to us about the city and give us some details, and he will fill the hour with interesting details. On the 25th, it's Thanksgiving time. It's time to be dark. We will not have a meeting. So the rest of this month is going to be a lot of fun here in the club, and there'll be some good programs. Just a heads up, when we get to December, pardon me, we're going to have a very interesting farmer who's also a Rotarian. And again, I don't want to tell you anything more than that, but I expect that will be very entertaining and interesting as well. So today is great to begin with. This meeting is added to the greatness of it. Let's go out and make it an outstanding day. Thank you everyone for being here. Have a good day.
Thanks, Ben.
Thanks, Joe.